there's a tipping point, right? Where how much money do you want to make? How fast?
Our mindsets are the same. So it's people over profit. Reputation is worth more than the dollars coming in.
Exactly. The medical model is, in my mind, backwards. It should not be reactive. It should be proactive. And your benefits should work for you proactively, right? I mean, if you're a general healthy individual, you can go all year never hitting that deductible,
right?
Which means they just get free money.
Tell me about the difference between like how a standard PT would treat an injury versus a functional physical therapist. All right, guys, we're going to welcome Guerrino Boni, a physical therapist, to the podcast. We're going to talk about a lot of things, including physical therapy, his thoughts on it, and then what the kind of different therapies are as a physical therapist. So, G, welcome to the podcast.
Thank you for having me. It's a pleasure.
So the first thing is, people won't know this, is you were my clinical instructor before I was even in PT school as an undergrad.
That was like 3 weeks ago.
Yeah, I wish.
Yeah.
So we go way back.
We do.
And then you started training jiu-jitsu. Now your kids are here.
Yep.
Right.
So yeah, we started with you, years and years ago, my wife and I, just the two of us, and then our children happened and we had to take a break. And now instead of me training with you, it's them.
And we're just doing podcasts.
And now we're doing podcasts.
So just tell me a backstory, because I actually don't know this. How did you become a physical therapist and why?
So if I give you stuff you don't even know, in reality, when I was at Fairfield University and I was pre-med, I wanted to be an orthopedic surgeon. And then I did my first clinical. It was more like observational clinical. It wasn't real clinical. At my senior year there. And I went to Bridgeport Hospital. And my second day at Bridgeport Hospital, I realized I hate hospitals. To work in, like the working environment and like the ins and outs. And I thought to myself, I'm going to live in one of these things. So I still loved orthopedics. I still loved medicine. But I was like, I just can't. I just don't want to be in this. This isn't my realm. And it was one of my teachers suggested to me, hey, this is my chiropractor. Maybe you should hang out with him. Because after chatting about what am I going to do, I just took MCATs and I don't even know what I want. And I went to go visit his chiropractor and observe for a day. And he was really, really nice. And he showed me a lot of things. And it was really cool. But it just felt like I was off the mark a little bit. And he's the one who goes, this is a sports PT guy you should check out. Sounds like things you were into. I played a lot of soccer and I was really into my sports. And so I walked into that guy's office and that's when like all the bells went off. And I
you internally knew.
Instantly.
Yeah.
Within 30 seconds of being in that building, in that room, I was like, I found it. I love this. This is what I want to do. And that's it. That set me on the track. And I applied to URI amongst places, but URI was close and they had a very good program. I'm from Connecticut. And the rest was history. I graduated in 2003 from URI and started working locally. And that's where I met you.
Right.
You were a student at
I had the same hair.
Same hair.
Just not as gray.
Right.
Yeah.
Right.
Not as much
gray.
scruff.
No, not as much scruff. And I was just as I am with no hair.
You look exactly the same, actually. You might be a vampire. So how long have you been a practicing physical therapist?
So I graduated in 2003. So we're working on 20 years. This is 19 and change.
And so now you have your own clinic, right?
Right. So in 2014, I broke off from my old job. It was growing, and I wasn't in that mode of like, I want to get this big and be part of this big of a conglomerate thing. I wanted to keep it more intimate. And I really wanted to just have my own way, So I opened up Form and Function September 29th, 2014 in North Kingstown here in Rhode Island. And
how important for you was it to keep that intimate setting, right? Because what people might not know is that when there's insurance changes, right, especially in the medical community, what they do on the provider is like, okay, so now you have to see many more patients to even make the living you made before. Right.
That's that doesn't change. I mean, I still have to see a lot of patients. There's to put it kindly, let's say, there's a tipping point, right? Where how much money do you want to make? How fast? And that everybody's a little different. Who falls on that spectrum of like, I really want to, I got to pump. I want to pump numbers. I want to grow. I want to open a satellite. And you're going to have to work really, really hard. You're going to have to sacrifice, early morning.
Are you sacrificing quality of care in most instances?
Well, in most instances, absolutely, right? Because you have to have that extra 2 people, but that one less helper so that you can really pump your profits, right? And then you can open a second and a third and a fourth. And that's how you grow, basically, in this industry. So,
in a lot of medical industries,
right? And basically all, look at the hospital models.
Right.
Cut back. Somebody wants to retire, wants to move on. Don't replace them. Just give other people their work. And we retain profits. It doesn't make it any easier on the staff, and it's not a great experience for the patient, but that's how profit happens. For me, I looked at it and said, you know what? My goal is not to open a second clinic. My goal is to cap this one out, right, in my building without really pushing that fast growth. So my growth was a little slow, but it was right on par where I thought I would be. So where I am now is I have another physical therapist with me full time with a slightly different specialty. So she specializes in vestibular care, which is that inner ear vertigo.
When you're dizzy.
That dizziness and the factors that correlate to it, because 100 different reasons why that could happen too, right? And I have a PTA that was a student of mine who's coming back on next month. And the 3 of us, I call that a packed house. It really isn't room for more, and I might see 2 or 3 people per hour. And I have an aide that helps us out, right? And it's all in one big open room. So everybody's involved. Like I might be working on someone on a table, but at the same time, I'm paying attention to what's going on with my other patient or 2 that's doing exercises that my aide is following. And so it's like a constant discussion, and you remember some of that from when you were in the PT realm with us, but it's not quite as big and busy. So I don't want 6 PTs in my room, each of them with 3 people, and it gets really chaotic. It stays smaller, it stays more intimate. And because it is so much smaller, similar to the way you run jiu-jitsu with your staff, if you have to pop out, they know to pop in and help. And they know exactly what you would do and exactly how it's going to look and exactly what, would be on the script for a class.
So I think one of the reasons why we connected so well is that our mindsets are the same. So it's people over profit, right? And so even with the jiu-jitsu, it's like, cool, like we're growing, but I need to make sure that the quality of my students stays. And I've always been on top of that, right? And I'm going to actually add an extra staff member to make sure as we grow, the quality doesn't go down.
Right. And I've always looked at it like I'd rather see better quality and consistent staff, right? So I was like, I want to pay them a little better. I want to retain who I have. I don't want turnover. I don't want to see people coming and going constantly. Students do that. You're going to have turnover of students, but we call that the free help,
Yeah.
But so I want everybody who comes to see me, and I love that. Somebody I might have treated 3 years ago for, such and such problem for 2 or 3 months. And they really loved it. And they loved the environment and the banter and how much fun we have and the level of activity that they were doing in PT, which like, wow, we never did this kind of stuff in our other places.
Heard that a lot. Yeah.
Yep. And then 4 years later, they walk back through the door and they're like, Michelle, you're still here. Kyla, you're still here. Everybody's still here. And I'm like, well, what did you think? They're used to seeing that turnover in other places. But, they love it when they come back and it's all the same people, maybe a different student helping. And then they feel like they're the one hazing the student because they've been here longer than the student.
Yeah, and
know they're more family than them.
Sense of community.
Very big sense of community.
And I think when you have the mindset that we have, right, your reputation is worth more than the dollars coming in.
Exactly.
Right. So, and I think this is important when anyone's looking for, doctor, a physical therapist, a hobby, a jiu-jitsu school, fitness school, whatever. It's the fact that you want to find a place where it's a sense of community, where they are really concerned with your results.
Exactly.
Right.
Yeah, I mean, you can see it. It's like when a patient comes in, let's say on a Monday, and how are you doing today? And it's like, well, that thing we were working on it's starting to really get better, but something else is popping up here, and it's really, well, let's sit down. Let's take a look at it really quick. The fact that you do that, right? That you're like, well, let's just keep shoving along with what we were working on. No, let's stop and look at this new injury. Just give me 5 minutes to see what's going on. Maybe I can tweak one or two of your exercises to incorporate it. Maybe I can give you a few suggestions for home. Or I can tell you exactly what we have to tell the doctor so that we can make this part of our treatment too.
So I think a lot of times I hear, well, like this doctor has no bedside manner, right?
Yep.
And innately, I believe if you go into medicine, like you care about people, right? Like, but I think because they're overworked, and a lot of times, listen, like when you're trying to be the guiding light, and a lot of times you're trying to help bring people out of their injuries, like when people are injured, it's normal to be sad, depressed.
Sure.
And so the fact that you have to see so many patients and they're coming in a lower vibration, I think that's why a lot of times doctors, even police officers, have a hard time staying level.
Exactly.
They stop listening.
Well, you know how fast you get jaded, right?
Yeah, sure.
And if you get tossed a lot, you get jaded much quicker. Your environment, I think, plays a monstrous role in that. Like I said, we do see a lot of patients. It's not like I'm seeing one person per hour and it's like just me and you. It's, right. There's a well-oiled machine happening here. But the environment you create, right, that creates that positive energy. So patients that come through here, I hear it again and again and again. I'm sure you hear it in the jiu-jitsu world here. I love your atmosphere. I love how everybody feels so happy. I don't want to leave. I hear that a lot. I feel like I have to kick patients out sometimes. I'm like, you're done. And I go, but I like it here.
Right.
I know, but you're done.
Yeah.
So it's the environment you create. And I think that is what lacks in some of those other areas, right? When you're in the doctor's world, when you're working in large orthopedic groups with a hospital, it's a different type of beast. It's a different type of machine, but it's very sterile and it's very sometimes unfriendly, that
in and out,
and that you're dealing also still with patients with difficult injuries, some of them chronic injuries, and they really need your help. But you've got your upper administration saying, yeah, but you only get 5 minutes with them. Toss them to the PA and get going. And then PA is burdened with that same thing and that same run around, and it gets very difficult.
Which is why the emphasis on medicine should be preventative versus reactive. Right.
This is a podcast for the insurance companies, right? It's
they'd save money.
The medical model is, in my mind, backwards. It should not be reactive. It should be proactive, and your benefits should work for you proactively, right?
And kids should be taught in school. This is how you eat
better.
This is why you need to keep your body moving. Hey, listen, your body's normally going to get arthritis. Just move. Right? If you move every day, when you're older, you might not have to take medication.
Yeah,
right?
Exactly. There should be, and emphasis shouldn't be put on. This is part of some of the functional schooling we were given through the Gray Institute, Gary Gray. It was all about empowering children. He used this wonderful, almost like allegory story where it was you take really little kids, right? And this is kind of, you don't even have to do a study on this. If you disagree with this, then you probably don't have children, is what I say. When you have preschoolers and you ask a bunch of preschoolers, hey, is everybody here an artist? They all raise their hand. You can all draw me artistic pictures? Yes. How about sports? You guys all athletes? Everybody raises their hand. All right. Is everybody really good in school? You practice your reading? They all raise their hand. They answer, yeah, I do my ABCs. I play outside. I draw. Come back to that same group of kids when they're in second grade. How many of you guys are artists? You only get about 50% of them raising their hand.
And why do you think that is?
Because they were told at some point before they reach second grade, artists do this. You're not that. You're not an artist. You're going to be this. You're not good enough for that. So the fun got taken out somewhere, and they were told, in a, maybe not intentionally, but in a negative manner, because that's how we were all brought up, right? You're not that good at this. You're good at this. Instead of telling them, hey, you could do whatever you want. It doesn't matter if you draw as well as Susie or Johnny. You draw different. And if you're happy with it, have fun.
Yes. So one of my favorite quotes is that, children are pure positive energy.
Right.
They come in cable ready. Like, there's no explanation for why a 1-year-old can use a tablet. Right? Like, but it happens because you're already ready. You have that inner being. but we beat the positivity out of them by the age of 3.
We kind of do. Society does.
And we were trying to control them.
Right.
Okay, Johnny, don't do that, right? Like, because I don't want to deal with that as an adult. And that's what happens. And to your point.
To my point. And then there's the other half of me who's a parent.
Yeah, sure.
Right?
And you're tired.
And it's not even that, but I can see his little mind. I know where this is going. There's going to be a fight soon.
Okay,
so, right? So you're also trying to diffuse a potential thing happening before it happens, but at the same time, you want to, stop their impulse for something that might be detrimental or negative, and at the same time, it's a juggling. And I get the difficulty in this. It's not it's easy to talk about. In practice, it takes a lot of constant adjustment. It takes, you have to have the ability to fail. And be good with that.
Bring me back to the point that Gary Gray was making.
Right. So the point Gary Gray was making is, preschoolers, they're good at everything. They think they can do anything. By the time they reach high school, when you ask those same questions, you're going to get maybe 0.5% of each of those kids in that room saying that they're capable and good at these things. They just either have been so jaded that they don't care anymore, or they've been jaded enough to think that they're not that good at it. And, our design for empowering them and enriching their minds is selective as opposed to inclusive. And that's one of the same thing is happening in the medical realm, right? In the insurances, the insurance companies are selective, right? The latest change that has been very frustrating for both doctors and physical therapists is if you come to me and you fell on your arm, wrenched it, and you felt something searing, pain happened, you're getting numbness, you come in and we poke around, we do a few tests, and it looks very much like a rotator cuff tear. I think you have a rotator cuff tear. Off to the doctor you go. Doctor does his exam. Oh, well, this looks like a rotator cuff tear. We need to get an MRI. Put in for an MRI. Blue Cross says, no. We have a protocol. Let's get an X-ray, then 6 weeks of PT, and then an MRI. But you just had 4 medical professionals tell you from experience and with testing, this is a rotator cuff tear.
And just for people who don't know, the X-ray is not going to show the muscle tear.
Right. The X-ray, right? The X-ray is like your cheap, this is all about money.
Yeah, right.
It's your cheapest film.
Sure.
Right? And it gives you the bone study. Yes, there's no broken bones. Ha ha ha. Oh, it might be a little arthritis. You're 50 years old. To be expected, right? There's nothing wrong with that image.
But your muscle's hanging off the bone.
But the muscle's hanging off the bone. And you're in a lot of pain. And, conservative PT. I'm like, okay, I can do conservative PT. We'll get some range of motion back. We'll get some ultrasound. We were going to do that anyway.
Right.
Right? We were going to do that pre-surgery regardless so that you would be at your best self going into surgery, if that was the necessary option. But we don't know how big that tear is. We don't know what location exactly it might be in and how much it's going to impact things. So I'm going to be timid about what I give them to do because I don't want to aggravate it further either. So now we're just burning PT dollars. Now we're burning time. They're frustrated. I can sense it. I'm trying to keep them optimistic.
And most time with PT, they're going to be in more pain.
Yeah.
Right?
Yeah. Well, we're working them a little bit. So, but we're trying to play that teeter-totter game of work them, but don't aggravate, and give them the tools to further de-inflame and how to make things better. And some patients will get a little better because maybe it wasn't so bad. And we weren't going to be looking at surgery anyway, but we still want to see what's going on in there.
Right.
Right. And others are not. Others are just getting more frustrated because we're waiting for that study.
And they get mad.
We get mad too. We get frustrated. We expect the insurance company to take our professional advice, but they don't. Yep. They have their own set of rules, and it's a cost-saving measure.
Sure.
And once again, it's reactive. It's not proactive.
And a lot of times it's not people before profits. It's profits before anything else.
It's 1,000%.
Right.
Those guys post such big earning profits every quarter, and you're thinking to yourself, I hate to say it, how is capitalist thought good for medicine?
It's not.
No, absolutely not. Because it does not put a person first. It puts the profit first.
Right.
Always and forever.
And so do you think that PT should be emphasized more in the medical community? Because I remember when we were in school, they were talking about in the Army, the PT triaged where the patient goes, right? So they do the PT first, and then you need to go see the doctor,
right?
Or I got this. You just need these exercises.
So PT should be emphasized. I do think because a lot of patients will come that I've seen over the years, right? Coming back with new injuries because they're active people, or recurrent chronic problems that need to be tended to once in a while because they're going to re-injure it regardless of how well they're kept. They'll come to me and they'll say on the phone, right? Hey, G, I need to come see you. I think I hurt something new. Oh, what did you do? Well, I think I twisted my knee. Did you see a doctor? Well, no, you know me better than anyone. Sure. That's what they say. And they want me to see it first. And I'm like, okay, I'll take a look at it, you know. But in Rhode Island anyway, believe it or not, every other state around us, you can go to PT.
I believe it.
Right? You can go to PT without a script, without an order from the doctor. We call it direct access. And direct access is universal. It means you can come see me. But in Rhode Island, the insurance companies will not honor that unless there's a doctor's order.
Which means you don't get paid.
Which means I don't get paid. I can only offer you a self-pay. And you can come see me and pay cash. They love that because they're like, yeah, go ahead. Go see him. I'm not going to pay.
They don't have to pay.
Right. But in every other state, you can just walk in and it is covered by insurance.
So I remember, I believe it was Dr. Lewinsky when we were in school. He was saying that, like, and I agree with this, people should see a physical therapist like twice a year, like they do a dentist, right? Yeah. Because we're going to look at you and we're going to be like, okay, well, a lot of times, especially in this day and age, posture is a huge thing that causes all these ailments, right?
We have a whole ton of that.
So we can just like screen you and be like, do this. Listen, I would do these exercises because this is what looks like it's going to happen. Right? How do you feel about that? Should it be like that?
That model would be amazing.
Yeah.
If you could convince an insurance company to say, hey, would you be willing to reimburse like a twice a year, every 6 months, like you do, you know, at the dentist for a checkup, preventatively? They might say yes, but I bet you they would probably put in their caveats of, but that doesn't mean you get to treat that.
Yeah, probably.
We won't cover that. It just means you can screen that.
Yeah.
So, I mean, that model sounds wonderful. It would be a wonderful preventative tool. A lot of PTs are turning to those models with a cash-based system. So, you know, it's like, look, you have a high deductible, which is a new thing too, right? Everybody's got high family deductibles.
They almost price people out of being able to get medical services.
100%.
So you pay all this insurance, but when you need to use it, it's like, well, we're not going to cover it until you put $5,000 down.
It is.
Right?
It is the most brilliant scheme in the world.
Yeah.
I mean, if you want to talk about the most brilliant Ponzi scheme, you have to pay the average person $450 to $500 a month for a Blue Cross or United plan, right? Boom, that's your monthly fee. Wait a minute, there's a $1,500 deductible attached to that per person, or $3,000 per family. Okay, so that means we don't touch a thing until you cover that, save for this prescription drug because we have a deal with that company. And your annual physical because we want to look like nice people. So we're not. So, you know, you get that annual for free and you get these prescription drugs because we got to have our drugs for free or covered with your copay. But everything else, deductible first. And then after deductible, it's copay.
And that can be high.
Now, the way that, to make some people understand this, the copays and the coinsurances, all that stuff, if you never had to work with it, it basically means, like, if I bill out for PT these X amount of codes, right? And let's say those codes are worth $150, let's say, in treatment. I'm not getting $150. Right. I'm getting what the insurance company has allotted.
And decided,
right? It's all pre-decided. So I'm going to get a cap of, let's say, 60-something. So no matter what I bill out, I'm only going to get $60-something. Of which the patient is responsible for a percentage.
Sure.
So I might only get $40 and you have to pay $20 after your deductible. So $450 a month, $1,500 worth in deductible, and $15 to $20 in copay. And they only have to pay $40 per treatment.
Right. The insurance company will pay.
Eventually, after you hit that amount. Right? So if you're a general healthy individual, you can go all year never hitting that deductible.
Right.
Which means they just get free money.
And there's your business model.
Yeah. Just give us free money constantly.
So here are my thoughts on physical therapy. After surgery or like a recent injury, it's absolutely necessary for everyone. Even chronically, it's necessary.
It's very true, yeah.
But I think they didn't give us enough. And hear me out on this. Because, like, Yeah, sure. Let's say someone's coming in that 100 pounds overweight. They have a knee problem. Sure. I can help you feel good, kind of strengthen the knee. But I'm not really solving the actual issue, which is you're 100 pounds overweight, right, or you have back pain, right? So it's one-dimensional in the fact that, like, I'm helping you do the stretches, get stronger, educate you.
Yeah.
I'm doing nothing about the nutrition, right? And I'm doing nothing about the accountability to make sure I'm checking in with you to do the exercises at home. So it's like a third of what you actually need, right? So yeah, I'm not really going to be that successful treating you for that low back pain because we have all these other factors going on and you're smoking.
Right. There's, I will happily say that more and more of that elephant in the room gets addressed more frequently now.
Okay. By who?
By the whole group, from never the insurance company. The doctors are becoming increasingly aware, obviously that these are big factors, and more doctors are educated enough and becoming aloof to the notion that we can't just pump these people full of these meds,
right,
and watching them deteriorate. So they're becoming more global in their approach to the patient, and which is wonderful to see, because the doctors respect that. When you return to them and say, hey, so-and-so is doing really, really well, we got to get them to stop smoking. We got to get them to...
Because smoking stops the healing process.
Well, I mean, smoking is horrible in a million ways. Right. We can get into a whole different discussion about that. But yeah, it stops the healing process. It inhibits you from recovering just from regular exercise. So you stay sore longer. Your muscles fatigue quicker. When you have problems in your tissue, they don't heal nearly as fast. So even when, let's say you have this, let's say a classic injury like a gluteus medius tendonitis or a slight tear, like this.
That's your butt.
Your butt muscle, your side butt. So people end up with, it's a fairly common injury, side butt pain.
I think we just coined a new term.
Yeah, side butt pain. I love coining terms. It's great. So side butt pain, right? You have this 3-month process. It's been hurting increasingly. Even when we are trying to treat it and we have to dig out knots or we're trying to break up some fascia problems, the recovery just from that takes longer than the average person because you're not getting the oxygenated blood properly thanks to smoking habits. Right. The beautiful part is you stop smoking, your body will reverse that and you will start to get better. You just have to, and there's a lot to be said for addiction, not just addiction to drugs and things. We are, we're a comfort society, a comfort being. We like being able to feel good when the world is throwing us a billion stresses a minute, right? That's a comfort mechanism. So you're also trying to tell someone, so trying to understand it from their perspective, right? You're telling a smoker, I need you to take that comfort away.
Right.
Now it's hurting you. And they're saying, yes, but it's making me feel good when the world hurts me.
Right. And in that case, they need a different way to deal with stress.
Exactly.
And be educated.
One of the biggest things is I think we need to not shift, but build off of in our medical and universal model is, yes, we need to get you away from these bad things, but we need to provide them with better alternatives to get that comfort and to stimulate them and provide that positive outlet.
And have a team approach.
Always.
A doctor, a physical therapist, a nutritionist, and be like, we're a team, right? It's kind of what we do in like the fitness kickboxing. You have your instructors, you have the people helping you with nutrition, you have the accountability coach, right? So you have a team, and that's why you get better results.
In a microcosm, that's what I've sought to build in our clinic, right? One of my employees got a nutrition certification. She's not a certified nutritionist, but whenever I have patients like small issues, we can sit with them and say, look, it's like, I want you to check this out with the doctor, but it sounds like we might want to use a little more B12 in your system. There's some mushroom that might help you. Yeah, little guidance so that we can help them with, like, here's some good anti-inflammatory supplements, like here's a tea, here's an herb root, easy to use, things you can work with, that you can cook with that might benefit you. It's like simple anti-anxiety things as well. Like, there's a lot of natural remedies. Now, it's not to say we're going to replace all the meds they're on. I don't have that authority, nor do I want that responsibility, frankly. But any encouragement we can give them, like to teach them nutritionally, you may want to avoid these types of foods. Why? You tend to have a gluten allergy, or your blood pressure is high, you're eating way too many salts. We need to find you an alternative. And people don't know that there are alternatives to so many things. It's the more you talk to them, the more you realize people, we're in the realm. So I am versed. I think everybody is versed in nutrition the way I am, but it's a very small percentage that, sees and reads the things that we see and read. So when you teach it to others, you really are like, wow, I didn't realize how much I have to give. Right?
So one of the things I heard, I think it's Alex Hormozy say, is that we don't realize, or it could have been someone else, but we don't realize the knowledge that's common to us is not common to other people.
Right.
And I tell people, I can nail 2 pieces of wood together, but you're not going to want to live in a house I try to build for you because I don't have that knowledge of construction work. So that's why you come to someone like us.
Exactly. Like most people have that 101 level knowledge, that intro class knowledge. But that's why they're coming to you. It's not just, and, because it's been so beneficial in the world of PT, to be able to expand that knowledge base, to tell them, yes, let's work on this joint and that joint, and here's your problems with it, and let me describe it to you, make you understand. But it's also important that we now say, hey, this is nutrition that you should be paying attention to.
And I think the thing that people might not know is that out of really all the medical professionals, including chiropractors, people spend more time with the physical therapist than I think anybody else. 3 times a week, 45 minutes, multiple weeks.
Yep.
So we're one of the biggest influences in a patient's life.
And we have insight into things that, you don't remember to tell a doctor absolutely everything in that 5 minutes that he walks in the room. But in the 25 minutes when I'm doing my manual work and it's just us chatting, or, in the 50 minutes when everybody's chatting in the room while you're doing your workout, things come out. Oh, yeah, you know what? I didn't tell him, but this thing happened.
Because you have that time with them.
You have time, and you're able to sneak out these bits of information because there's discussions happening, and and that's how the brain works. It bounces from idea to idea.
So tell me about the difference between how a standard PT would treat an injury versus a functional physical therapist.
In the traditional therapy model, I'm going to call it traditional because it's ever-changing and a lot of PTs really embracing new models. The traditional model from 90s and early 2000s, which unfortunately still happens a lot in places, is single joint. That's what I'm focused on. So you come
an elbow.
Yeah, elbow or knee pain. Okay, let me see that knee, right? We're going to tape the knee. We're going to tape the elbow. We're going to do these mobs to the knee. And that's my focus, and that's my focus. And we're going to do quad exercises, and we're going to do these exercises, and we're going to try to influence that kneecap and VMO. Focused on that area, right? I'm going to give you the spiel, right? Or I think you've probably heard me do this 1,000 times.
Might have been a while.
Right? But so when you say the knee joint, and for our viewers who are watching, I'm going to give you a visual demo too, but I'll describe it. The knee joint is essentially the femur, or the big thigh bone, meeting the foreleg bone, which is the tibia. Boom, that's the knee joint. It's just the meeting of those two bones. They're organized in such a way, there's condyles, which curved surfaces off of the femur, and flattened surfaces off of the tibia. And that's your meniscus, which provides like a little cushion. It's like convex shape. And then the femur comes down with this concave shape, and it allows you to do this like gliding. So it bends with this nice glide. So the femur doesn't just hinge, right? The femur slides forward as you bend the knee. So it creates this slide and glide motion. The patella is shaped with this little wedge in the back.
Which is the kneecap.
The kneecap, right? The kneecap has this little wedge shape in the back. And the two bones have this wedge shape in the front. It's almost like a train track, right? And the kneecap is the train. And it slides on its track. So for years and years and years, knee pain and that patella, that kneecap is not tracking properly. We were forcing that kneecap. We'd say, tape the knee, hit the VMO. It's got to pull the kneecap back. The reality is the two bones were, nobody looked at the two bones and their alignment and their influences. So if the two bones, if the top one was rotated out just a little bit, we call that external rotation, it made it look like the bottom one was relatively internally rotated, right? Relative to the top, this one looked like it was rolled way in. So now where is the train track? One of them's rolled in and one of them's rolled out.
They don't connect.
Yeah, that kneecap has to jump the track, causing a lot of problems. So then you say, okay, it's not the kneecap's fault. It's clearly the two bones. Oh, what influences those two bones? Let's go all the way to the top of that femur, the big hip muscles. That's what controls the rotation in that big bone. And then let's go to the tibia. Let's go all the way down to the foot. The foot mechanics controls how that tibia rotates. So we took a knee pain, right? And now I'm treating hip and ankle. And I'm even going further from there because maybe that hip is being influenced by a really tight low back, a really tight thoracic spine. Maybe that foot is being influenced by really tight cuboid bones, the little bones in your midfoot.
And what people don't know is your foot's always in contact.
Constantly.
So the force from hitting the floor or whatever goes up the chain.
Goes all the way up the chain.
Right.
So the point of the whole thing is the traditional model looked at single joint pain and problems. It's your arm, we're treating the arm. In a functional model, the whole chain reaction from the foot hitting the ground up to the base of the spine, in the neck, and even the eyes, right? Your eye line controlling where you're going to position your head and how you're in your posture. All of that plays a role. And we have to look for the biggest contributors and provide movement correction exercises to hit things all along that chain, right?
Which goes to treat the whole body.
And therefore release the pain at that specific joint.
Correct. And then one of the fights with that is like, well, insurance says you can only treat the knee.
Right.
So like if you're like, why are you doing the shoulder?
Yeah, and that's where you play the game of like, justify.
As long as you can justify.
As long as you can and it's not that hard. If increasingly easy to justify and have it accepted that, look, they have lateral knee pain, their IT band running up the side of their leg is really tight. Now it wraps around to the back of the SI joint and into the lower lumbar spine. Therefore, I'm doing lumbar manipulation and I'm doing IT band stretches because of that lateral knee pain. And
I think like one of the things I definitely learned working with you was that like every movement is functional. Right. If I'm going to reach for the top shelf, most of the times I can reach it. Sometimes I can't. But
different type of challenge.
Different type. So like I'm not just going like this. Like my whole body extends. Right. So when we do movements in life that are triplanar all over the place. So when people work out in like my fitness class, like I'm like, cool. Like if you're doing the arm, you can move your whole body. Right. Exactly. Versus traditional bodybuilding.
Yes. And that's another major model that has yet to change, and that's the workout like a bodybuilder, right? I love working out like a bodybuilder.
It looks like you do.
Because you get to build your muscles.
Right.
I'm not building functional muscles, though.
Right.
I'm building pretty muscles. Right. Functional muscles is a different set.
You're built for show, not to go.
Built for show, not to go.
Yeah.
If you want to integrate go muscles, you have to start training a little functionally. And, I do it at least twice a week because the older you get, believe it or not, you pack on more meat, but it makes you tighter.
And two things I want to just talk about really quickly because we got 5 minutes.
Yep.
The True Stretch machine that you use in your clinic.
Yep.
We're going to show the clip of that, but what is that for?
This is the True Stretch device that's used in physical therapy clinics and increasingly in gyms. The versatility of this device is its ability to let a client or a patient have lots of points of contact for handholds so that you can do dynamic stretching, static stretching, and it allows room for a practitioner or a trainer to get in with the client to help them to mobilize joints or to hold joints in place while other joints are mobilized to get even more bang for your buck out of your dynamic stretching so you can get to the problem areas quicker and more effectively. So, as you see that clip, the True Stretch machine really provides you with lots of points of contact. It looks like we call it the cage, right? And he's got all these different bars and grabs so that as you get in there, and if you want to stretch your hamstring, your quadratus, your low back, your deep low back muscles, your hip muscles, your lats and your mid back, and you want to really manipulate your thoracic spine, your rib cage area, it gives you all these points of contact where you can manipulate the body in that triplane, that 3D
functional
space. Yeah. So we can rotate and extend and all these things at the same time. And there's room for the practitioner to get in there with you to manipulate and say, all right, get into this posture. Now I'm going to show you. I want you to rock forward and back like this. I want you to rock side to side and rotate.
And it's safe for patients.
It's very safe.
Because you can grab on and
I'll have to tell you this to all the people listening that say, oh, you know what, I really need to have somebody coach me through this. In functional movement, intuition is everything. When people go, I really felt like I just needed to shift like this. I go, yeah, that's exactly what you needed to do. Your body told you.
Right.
Sometimes when there's pain, especially, you get into that motion and something feels off. So you say, maybe I should wait and let him check. And that's smart. That's exactly why we do that. So patients will come to me and they'll go, oh, yeah, I was thinking I should do this, but I was worried because it caused pain. And then I'm there to tell them, but this movement's okay. You can go into this a little bit. Don't worry about it.
So I wrote some lessons I learned from being a PT. Number one is you need to give people hope, right? If they're kinesiophobic, they're afraid to move. We had a client here. It's okay. Do what you can.
Yeah.
And now they're like, wow, and they're doing stuff, right? So give them hope. The second thing, the effects of neglecting your body or not caring about your health at an early age has a huge impact on your quality of life as you age.
Right.
It's that whole preventative versus reactive. Working in a nursing home or hospital, especially as like a 20-year-old, you realize how precious life is because you see patients at the end of life. Yes. And you can almost tell when they're ready to go.
I've been there and I've worked in those environments during my clinicals, and it's a challenging, rewarding, but very difficult sight to see.
Yes, and I agree with you. So you kind of realize how important it is to live the life you want and follow your dreams. And then helping people is the best feeling in the world, right? Getting that feedback.
It's wonderful. When somebody comes and goes, I can't believe it. Can you see? Watch me move. And they're so happy, that they can do this now. And that is very rewarding, and that's exactly why we do it.
Right. And that's why I believe if you're in the medical community, you have to care about people. Yeah. So the last thing, someone's watching this right now. They're in pain. They're afraid to move.
Yeah.
They just watched this podcast. What is your advice to them?
Oh, crap.
I put you on the spot.
So my advice to them is all the things we've been saying, right? If you have somebody who's been through PT, and usually, you can listen to ads and you can listen to us talk, right? But normally, the first thing you're going to do is ask a friend, somebody who's been there. How was their experience? And that's how I would do it too, right? So then my first thing would say is...
Experience with the injury or like a PT?
With a PT.
Okay, so you're telling them, look for a PT.
Look for a PT, right? Look for somebody who's been to a PT who they've had a great experience with. Talk to your doctor. Sometimes they have a PT they can highly recommend. In Rhode Island, you have to go through that gatekeeper, that doctor. Very few insurances let you just walk through the door. So you will have to have a conversation with your doctor or a nurse practitioner or family medicine, somebody who can prescribe you an order for PT. Many times they'll have their favorites too that you can listen to and take an option. Now, what I will also say is, they might have a prescription pad that says PT to X place. And so you say, I have to go to this place. That's false. You can take that prescription and march into any office, physical therapy office you want to. It's illegal for them to tell you you have to go to this one place. So it can be recommended, and sometimes those recommendations are clutch. But if you have somewhere
sometimes that money influenced.
Well, sometimes they are, but I'm just going to say, people have their recommendations, and sometimes it's a good recommendation, right? Oftentimes. But if you have someone that you're like, no, I really want to try so-and-so that my best friend loved, take that order and march into that person's office.
Sure. So your advice to them, see a physical therapist.
Sure.
Don't just sit there in pain.
No.
Because there's people who can help.
There's people can help you. You don't need to live your life in pain. And, even if we can't get rid of all the pain, the next thing you always have to say is we want to provide people hope. I like to also provide people a very realistic, right? Your chronic low back pain, something's always going to be in there. Maybe a teeny bit. But do we have to live like this? Absolutely not. There's 1,000 more things in your rapport of activity that you should be able to do pain-free and just have to deal with a teeny little crankiness now and then. I think that's a win. That's a big win. Right?
Yeah, because it's about improving that quality of life and taking actions to become a better you.
Better you for a very long time, right? That's when they say give them hope. Patients will often say like, I only got a few years of me left. I go, yeah. Well, I'll tell you when I'm 100 how I feel.
Yeah.
When I'm 100, I'm like, I plan on it. I plan on being here. I have no reason to see why not. And then patients look at you and go, I never thought of it.
And I think when you're 100, you'll still be wearing tight shirts.
I hope so.
Gee, love the podcast, buddy.
Wonderful.
Good luck and everything. Form and Function PT, North Kingston?
North Kingston, Rhode Island.
Yeah. Thank you.
Thank you very much.
Hey guys, Dr. Marc here. Now I know a lot of you want to know how we get all these amazing results with our clients, and it comes down to 3 things. The first is fun fitness classes that burn a lot of calories. 2 is giving you an accountability coach to make sure you stay on track and get the best results. And 3 is the nutrition. Included in the nutrition is our food supplement. So we pair with Prestige Labs because I feel they're the best, they have integrity, and they get great results. These are actually the supplements that I take as well. Here's the awesome part. By clicking the link below, you can save 40% off the retail price. So you need that link to actually save 40%. If you just go to the normal site without my link, you're paying full price. Okay? So These are the supplements my clients use. If you are interested, definitely click the link below and it'll tell you all about them.